there, people of the internet. My name is Odur Jagero, and this is Dialogues with Jagero. Today, I am on set with a lived experience expert in mental health, Mr. John Mwangi. Mr. John Mwangi, how are you doing?
I'm doing good.
And how are you really doing? Where is your mental in your mental space? How are you doing?
My mental space is doing okay. Mm-hmm. From a scale of 1 to 10, I'm at 8.
Yeah.
Yes. So I'm happy about it, and I've learned to live with my mental health condition positively. Yep.
When you say that you're at 8, I wonder where I am. Mm-hmm. I have a feeling that I'm up to 6. Uh-huh. Yeah. My mental health has been wishy-washy in the last 3 years.
Yeah, actually, it's true. Mental health is not a binary state.
Yeah,
it's based on a continuum. So it fluctuates between the continuums. Either there's no poor or good mental health. So it fluctuates between the whole continuum. Okay. So it's okay to be in different stages at different times.
Yeah. I feel like there is a lot of things going on in my life.
Yeah.
Especially running this podcast has brought in a lot of pressure for me. Uh-huh. It's very difficult to deal with cameras, to deal with guests, cancellations, takedowns. A lot of it goes on, and you're always wondering how are they going to receive this new video that I'm doing with John Mwangi. So there's a lot of anxiety involved. But here we are. I want to ask you a question about the mental state of the country. In your estimation, are we doing okay as Kenyans? And if we are not, what are some of the areas that are giving us a lot of that are distressing us? Yeah.
I think as Kenyans we are not doing well.
Yeah.
Because even I remember the last statistics that I checked in terms of mental health. Actually, in terms of depression, Kenya was rated the number 9th in the country, in the world, of people going through depression, and number 4 in Africa.
Oh.
Yeah, so that tells you we are not doing well as a country. Yeah.
And what would you say are the main pressure points that how we are getting hurt as Kenyans? Why are we not stable as a country mentally?
There's a lot of factors. If you look at the social environment, you can see a lot of the tough economic times. There's also the COVID pandemic. The repercussions of COVID pandemic, we still feel them till today. So that is also another aspect. And also drug and substance abuse. Yeah.
Do you mean pombe ile tunasikianga iko imeenea sana huko Mount Kenya na other parts of the country?
Yes, because in mental health, even drug and substance abuse is a mental condition. So under it, yeah.
Okay. Yeah. A lot of people talk about the repercussions of COVID. We were talking yesterday and you gave me a very interesting idea of why we have had a lot of problems with mental health after COVID. What specifically was it about COVID that made us our mental status deteriorate?
One thing about mental health is that there's what we look at the risk factors that contribute to mental health, and isolation is one big factor, because even for a person who is going through depression, one of the journeys of recovery is being pushed to do a lot of socialization, social interaction. So because of COVID, we came to be locked up, and there's lack of that social interaction. So that's a very high risk of people experiencing mental health condition. And also because there was also a lot of jobs that people lost, a lot of employment. So meaning that they're experiencing a lot of stressors in terms of employment, plus now isolation, and also the anxiety of we are not certain about the future. So that brings a lot of mental health issues.
I also hear that there was a lot of fighting between couples, a lot of fighting between parents and children. Perhaps this was also a key, factor in the same.
Yeah, Because sometimes if you look at when you're experiencing a lot of distress, even you at a normal space when you're fatigued, you'll find yourself you're too much irritable. So because of that anxiety and frustration because of COVID, so that level of irritability, short anger span, so there's high rate of people experiencing a lot of frictions within the family settings during that period.
Let's get back to your life. I would like you to tell me the story of how you grew up in Nakuru and how you started experiencing problems with your stomach that led to you being, ushered to psychiatric hospital and just starting to understand that probably I am mentally not okay and I need help.
For me, I grew up in the rural areas of Nakuru, that is in Bahati. So I'm a last born in a family of siblings of 3. So that is 1 sister, 1 brother, and both my parents are teachers. So for me, I grew up as a very happy child, and I love to be very outgoing. So even when the neighbors used to come and visit me at home, they actually came and say, that child is ever smiling, and everybody was happy about it. So, and I was very sporty because I engaged into a lot of sports. So that is basically how my childhood was. And I attended a private primary school. The funniest thing that people look at is because I studied from that primary school from nursery till class 8. So that's where most of my memories of childhood are. Yeah.
I remember when you were talking yesterday, you told me that you don't want to be employed because of course, issues that we're going to be talking about later in the episode.
Yes.
When you were growing up, what did you want to become? What was your childhood dream? Did you want to become a doctor? Did you want to become a nurse? What did you want to become?
What I wanted to become was a very big battle between me and my mother. Because from a young age, I wanted to be a military person. Because I used to see how the military are dressed in the military uniform during the parades, and I'm very happy about it. So I used to tell my mother, I want to be a military person. And I think my mother knew the background of what it means to be a military person. She used to tell me, no. Actually, that dream was still there. Because even in high school, I still wanted to be a military person. Even when we were choosing some of the career paths, I chose to do military science. Yeah.
Okay. By the way, you look like a police officer. Have you ever been told?
I think it's because of my height. Because a lot of people try to comment about my height because I'm around 6'1" feet, and. The funniest thing I tell people is that a lot of people tell me to pick for them stuff that are up. So every time I find the people who tell me that, I tell them, so you should also allow me to pick things that are down for you. I tell you to pick for me things that are down.
Yeah.
Because I cannot.
And then the conversation completely changes after that.
Yes.
So you grew up and you finished high school?
High school was a struggle. It was a deep struggle.
How so?
Yeah. Because around the high school, around Form 2, is when I got ill with malaria. So at that point now, that malaria was admitted in a hospital. But I started during that period. I also experienced certain symptoms. I started having a lot of hyperacidity, having a lot of vomiting. I was not sleeping at night during the wards. So despite the 2 weeks that I spent in the hospital, still the symptoms of hyperacidity, vomiting, and lack of sleep persisted. Yet the malaria had gone. So that's when now my difficult journey now started at that point. Because during that period, I started now moving to different hospitals in Nakuru. And I was done a lot of tests. I was done thyroid test, I was done heart test, I was done endoscopy, all those tests. And all those tests came out to be negative. But yet the symptoms of hyperacidity, dizziness, lack of sleep persisted. So it only resulted to the doctor start treating the issues of the symptoms that I was presenting. So I used to take a lot of medications for the acidity. So literally, even I could not literally take my own food in terms of the school meals. So if the people who know me from high school, they actually know the person that used to carry his own food to school.
Why were you carrying your own food to school?
Because I could never eat any other food, because if I eat any food that has even a little amount of oil, I would vomit. And because of that, I used to eat boiled food.
Boiled food?
Yes, only. So that means that the food in school was not fit for me to eat. So I was allowed to carry my own food, and it was a day school, that is Mwangi High School.
Mwangi High School, right in the middle of the city, right?
Yes, in town, yeah. Yeah.
That school looks really, really good, and it's in a very good neighborhood, right?
Yes, it is. It is one of the best day schools nationally. Yeah.
How does it compare to others nationally, like Stare?
I think the aspect that it is day and it's very convenient to all people in town. That's the reason why it's very, it attracts a lot of people, especially those who want to do education.
The idea of carrying your food to school and having problems with the hyperacidity all the time, how did that make you feel as probably a teenager that you were?
At that time, I was feeling a sense of a lack of hope, because I also felt yes, I used to carry my own food. People used to see it as a privilege. The other students used to see it as a privilege, but for me, it was something so much distressing to me, because even the boiled food itself, it was difficult to eat. So every time I used to take the food, you'll find I'm eating the food around 2 or 3 times, because even if I eat the first time, I'll vomit. So it was how distressing it was during that period. So, yeah.
You finished the high school, even though you were troubled, but you finished, right? High school.
Yes, because I stayed, it became as too much difficult for me to stay in school. So I ended up, instead of going to Form 4, I ended up repeating after staying at home for a whole year, because now the situation was so difficult for me to stay in school. Because even the funniest thing that I experience, and people don't understand it, and I think most people will not even understand it, is because by the virtue of I reading a book, I used to get bloated.
Oh.
Yes.
Really?
Yes.
Did you ever come to understand why that was happening to you?
Yes, I came to understand it much later. Yes.
Why?
Because all these stomach issues persisted during that period, the high school. So during the last year, when I was now in Form 4, I got a very major referral to a hospital in Nairobi. And that is the doctor that came closest to diagnosing me with actually what was happening. He actually, the first time he diagnosed me with anxiety disorder at that time. And he actually wrote a letter to the school that these persons will be treated with much more care at that period of time. And so that is the doctor that came close to what I was experiencing. But now, because the same struggle, and he actually told me to go back to school for the sake of going to school. So even the grade was not a matter of what I'm going to get. It was just a matter of going to there to socialize, to remove me from the environment of at home. So even me doing the KCSE was doing in a period where I was going a lot of distress. You can feel, even I'm telling you that if I'm experiencing a lot of bloating, by the virtue of reading a book, you can imagine going to tell your parent that I'm reading a book and I'm getting bloated. It is very difficult. They'll assume that you don't want to study.
Yeah, that's what I think everybody would assume.
Yes. So the funniest thing that I did while in my KCSE, despite the struggles, and I went to university, that is St. Paul's University, and I did procurement and project management. And that's when, after completion of campus, that's when I went to another doctor in Nairobi also, that now diagnosed me with irritable bowel syndrome. So irritable bowel syndrome is the reason why it's called irritable is because the tummy is irritable. Then the syndrome is because it's a disease. It's not a disease. So a syndrome is something they see the symptoms, but they don't know what is causing them. So by the virtue that I'm diagnosed with irritable bowel syndrome, that meant that I experience a lot of every person who is diagnosed with irritable bowel syndrome experience different kind of symptoms. For me, one of the symptoms was bloating, hyperacidity, dizziness. When I find myself, I'm reading, I'm getting bloated. When I eat, I'm puking. So even traveling was a struggle for me because I never used to travel even to school trips, because I had to plan every single meal that I'm going to eat. So it brought a lot of anxieties. And people used to say that I'm that person that is isolating themselves. And that made me also put myself in a cocoon where I'm isolating myself. So some of these symptoms of the reason why I used to read and get bloated is because of the irritable bowel syndrome. And the funniest thing about that condition is that it manifests through what they call the gut-brain axis. That means the brain communicates with the gut, and the gut communicates with the brain. So because of that communication, so the condition, they don't know which one is causing each other. Because if you have irritable bowel syndrome, you have discomfort in your tummy. Definitely is going to affect your moods. Then your moods will then again affect your stomach, so it becomes a cycle.
And this communication between the gut and the brain is some sort of miscommunication.
They actually don't know if it's a miscommunication, but they know there's a definite communication and the two are affecting each other. Yes.
Okay.
Yes.
So then reaches a time whereas perhaps you go to a doctor and you are first diagnosed with mental illness.
Yes, I was diagnosed with the anxiety disorder.
Tell me about how this came about, the process of you being diagnosed.
Anxiety disorder, I was diagnosed with it by the time I was still in high school, the last year. That's when I was diagnosed with anxiety disorder. But still I was not explained to what anxiety disorder was. So I was just being given medication. And you see, a letter was written to the school that this person should be treated with much more care. So for me, it was not a journey that I understood at that point. I only knew I'm experiencing tummy issues. That's all the thing I knew. So forever as a family, we used to treat tummy issues. Yes.
How were your parents? How supported were they? Were they confused? Were they distressed? What was going on with them? What were they telling you about this issue? Because I imagine that if I am a parent and my kid is having this problem, there is a way we can talk. Do we talk as African parents? Do we sit down and say, look, this is going to pass away, this is going to be treated? What assurances were you getting from your immediate family and the family and friends?
My family is actually my biggest support system because even my mother, I think we are so much genetically the same. And sometimes I look at us together and I think we might be twins with my mother. Because almost everything I undergo, somehow she undergoes it. And anything that affects me somehow affects her, and anything that affects her, it affects me. Some of the way emotionally we are connected, we are still connected the same. So even at home, there's this joke at home, but people say that the only person at home who can win a conversation with my mother is only me. The rest can't. So
it's amazing.
Yeah. So because my mother, we are so close at a personal level. But also the other family members, we are so close together. So the family has been so much supportive, as much as they also experience a lot of distress because of seeing me undergo all these struggles. The virtue that we are together made us to be strong and maneuver all through this struggle. Yeah. You
start your treatment. that story that you told me about you starting your treatment, and now that brings us into the real issue of mental illness. And right now, you're a big advocate or an activist. You want the laws of the country to change. You want the laws of work environment to change. You want the taxes on people who are suffering mental illness to change. You have a litany of changes that you want perhaps the government and the stakeholders to take control of. One of the things that you told me was how much HIV/AIDS and virus has been supported over the years, and not so much about mental illness. You have told me of how poorly mental illness has been budgeted for by the government of this country, and while other areas of life, especially, for example, the handicapped, the disabled. You told me that somebody who is who is suffering from mental illness is actually a disabled person. And there is, last week, interestingly, I was called by another lady who told me of her horror story. She was supposed to come to dialogues with Jagiru, but at the last minute, I think she could not come because of what you told me. I asked you that, and you told me that probably there is a trigger, or she can't just deal with the fact that people are going to even judge her more for the things that are happening in her life. She told me a story of her mother. Now, this is a big contrast from your mother, because for her, the family lost faith in her, and basically, in her words, she said that to her family, she's garbage, she's useless because she can't work. They put her up in a house, they send her money. They have to see the screenshot from the doctor for the bipolar medication. They have to pay the rent directly. They have to go to she has to go to the supermarket, and they can only pay at the till at the supermarket. Some crazy things. She told me of how she went to work, and then because of epilepsy, that apart on top of the bipolar, she's also suffering from epilepsy, and she alianguka when she was serving at a restaurant, and they had to terminate her contract. And every time she goes for an interview, and she comes forward and says that this is something that I'm suffering from, that you should know about in advance, they immediately cut off communication, and they don't want her again. So, and then you also told me the horrors of being in a psychiatric hospital, But now let's start with you being the first time that you went to a psychiatric hospital. You told me some story there. How did it happen?
Yeah, basically that happened after my completion of university, because I remember at that particular time, I think it's a very big celebration to actually complete a university, and it's celebrated by the community. Yeah. And I remember I was seeing when my family were actually celebrating and everyone was dancing, I actually cried.
Why?
Yeah?
Why? Why did you cry? Oh, you crying tears of happiness?
Exactly. That's what everyone perceived it to be.
Oh, yeah?
Yes. Because everybody was celebrating, and actually, and people were dancing and actually cried. So everybody assumed it to be tears of joy. But in me, I was saying, this is a cry for help. I wish you could see the battle that I'm going through within me. You could actually see me. But for everyone assumed it to be a cry for happiness. Yes, so just months after that celebration is when I attempted suicide. And it is that particular moment I remember. It was on a January 6th, 2019, on an evening, where I found myself at by the roadside, where I was feeling a lot of hopeless. I was feeling unworthy. I was feeling that I would like to end my life. And when I look around, I could see the whole world just around me. Everyone is just walking. minding their own business, and looking at me in amusement. Yet for me, at that particular moment, I just wanted someone just to hold my hand and tell me it's going to be okay. Mm-hmm. So, but at that particular moment, actually, on a level of impulsivity, I attempted the suicide. But my family at that particular moment is one that actually pulled me back from the verge of death by suicide. And we started now navigating the broken mental health care system.
Mm-hmm. Yes. How did you want to commit suicide? Did you want to jump on the road? What did you want to do?
I know that's a question a lot of people would like to know. Mm. But from what you know about suicide, we are supposed to avoid sharing the detailed information of that, because what we do by sharing the methods, the means, the place, we actually putting another person at a high risk of death by suicide.
Yeah, so probably giving them a way of doing it.
Yeah, that's the reason why you find people ask the same, so why do we have, when you see a death of a celebrity, you find there's a lot of copycats about it.
Okay.
It's because of how we decimate the message on suicide.
Okay.
Yeah.
I see. I didn't know about that at all.
Yes, it is. There's two ways it's actually been done through research.
Okay.
That if you share too much about the message about how suicide was committed, was done, where it happened, you'll find there's a lot of cases happening in that line. But if you do the opposite and share stories of how people have actually recovered and where to seek help, the opposite happened. People start reaching out for help. Yeah,
we learn every day.
Yeah.
And I think that's a very big learning for me. I've never heard about that.
Yeah.
Okay, good. So then you go to the hospital. What happens at the hospital?
Yes. Now you see, as all of us, we lack the knowledge about mental health. Even I didn't know about what mental health is. So all these symptoms I was experiencing, yet they were mental health symptoms, but we never knew and we never saw them as a family, as me and myself. And the knowledge that everyone has about mental health is the message that is out there in the public. So where am I taken to for mental health support? I'm taken to the places that everyone knows, that is the government facilities to get mental health treatment. So that's where my first stop was. So my virtue of getting into the mental health facility, that's the reason why my story is a story of compassion, because I felt there was a lack of compassion from the people that were supposed to provide me care. Because once I entered into the set of where the doctors were, actually they were not doctors, they were actually students learning Psychiatrist. So I'm seated on a bench where across me there are around 15 students. Then there's one senior nurse. Then they're starting to diagnose me. So I was being asked a series of questions. And for me, I felt as if they're intruding into my privacy, because how can you do a diagnosis when you have 15 people around me? It became a sense of as if they invaded in my privacy. I was not comfortable with it. And because of also what I shared with you about what you call the power imbalance, but the virtue that all of us, we lack the knowledge, we tend to accept what the doctors will say. So the doctors say that I should be admitted in the facility. So I was told to change the clothes, I was given food to eat, then I was taken to a small room. So in that room, I remember previous times when I was feeling suicidal, I used to tell my parents that I would like to be given assisted death that is medically induced. So when the psychiatrist came, the psychiatric nurse, they came with an injection. I thought, this is it.
Oh my God.
Yes, that is what rang in my mind. And you see, that's the other myth I think people have about suicide, is that when someone is suicidal, they actually, when they intended to die, that nothing can happen, which is actually false. We actually, in that moment, we actually fluctuate between two emotions. Yes, we feel that we want to die, but also we want to live. So we fluctuate between the two emotions. And that's the reason why reaching out to people at that particular moment is very critical. And that's the reason why you find a lot of people die by suicide, because when someone says that I want to die by suicide, or people in the community will say, nitakununulia hii, nitakufanyia nini, nitakufanyia hii. You see, that pushes a person to suicide. So for me, when I saw it, I thought, this is it. And I started asking them, what are you trying to give me? Instead of them explaining it to me, that this is the medication you are giving you, this is what the medication is all about, they assumed that I'm becoming violent. And the first thing was done was given slaps. And then I was pinned down by 5 men. And then I was injected the medication. For me, I never knew what the medication was. It was all about. I only came to wake up the following day at around 5 a.m. And I found myself in that room, had slept on the floor with only a mattress without blankets. I think that it's the cold breeze that woke me up at that particular time. And when I look at through a window, because it was locked through the metal door, and the windows were there, but they were broken. So I could only look at the small holes and see some of them passing by. And I shouted to them that I want to get out of this place. And when I told them that, they actually told me, let us take you to where the rest are. Yes. So for me, I felt, for that time I thought, because I felt as if my freedom is curtailed in that small room, I wanted to go, even if it's to get out of that space. So I was released to go to where the rest are. So I thought I'm going to a space where it's a ward, where I'm going to find a very conducive environment. So for me, when I went to that ward, I was surprised. I was met that we are so many people. I think that ward is supposed to hold 40 people, but I was there, we were around 100 people in that ward. And there was no places to sleep on. You could sleep on the floor. The ward are human flea infested. We used to be fed on human fleas. Yet this is supposed to be a hospital where you're supposed to receive care. And even the clothes were being given, they were tattered clothes that you're supposed to wear in the wards. So, and also it was so dirty because even this hygiene in terms of the washrooms, there were no washroom, people are defecating everywhere. That's how the situation, that's where you're spending this space to be. And yet this is the same space they want you to heal from. So that was the first interaction with the psychiatric ward.
I hope that you're enjoying this program. Over the last 15 years, I have been working online for clients in America, in Europe, and all over the world. And that is why it pains me a lot when I see a lot of African brothers and sisters saying that they do not have a job. Now, this is the problem. A lot of people are trying to look for a job in 2024 in their own town, in their local area. Now, the truth is, there are no jobs in Africa, at least not so many jobs. The good news is that we have internet these days. We have a tablet, we have a computer, we have a phone, and that means that we can do a lot of jobs, and those jobs are online. That is why over the last 4 years I've been writing a book that is called Digital Goldmine. It is a book that explains to you how you can earn money online. The 18 hustles that I've chosen are basically for Africans, because what happens when you are doing online jobs is that payment is usually a problem. So these 18 side hustles that I have put together in this book, you can be paid very well and very conveniently. Okay, so the book is only 1,000 Kenya shillings. That is about $10. You can buy it in Kenya using paybill number. You can buy it online from anywhere in the world using a credit or a debit card. All the information about this book is in the description below. And if you have a brother, you have a wife, you have a husband, you have a friend who is sitting at home and watching Netflix, please do buy this book for them. If you are the one sitting at home and watching Netflix and have nothing to do, please buy this book and your life is gonna change forever. Because I have been doing this online and I've been traveling and I've been enjoying myself and having a lot of fun. So thank you very much, and now back to programming. I want to take you back a little bit to where the the 15 or so interns were sort of trying to figure out what is wrong with you. The question, now that you have been in this space for some time, probably to understand what was going on there, because I'm thinking, if you were, let's say there are a set of 10 questions or a set of 20 questions, I would imagine that one intern would suffice, would be enough to ask all those questions. The other 15 or 14 of them, were they there to stand guard? Why were they all asking questions?
From my perspective, what I think was to happen is because the psychiatric nurses, as they go to, they're studying nursing and they're studying psychiatry, they have to go to the wards to learn about psychiatrist. So they have to be under the guidance of a senior, let's say senior nurse. So I think the issue is about the ratio of psychiatrists and the number of students. So because they don't want to maybe to attach one particular nurse to a certain psychiatrist, so they bundle them together to fasten the process.
Yeah.
Yet that virtue that you have a lot of people, it's also an invasion of your privacy.
My thinking, I don't know whether you would agree with me, is that you remember when we talked yesterday and you were looking at the power imbalance, and sometimes the people that are mentally ill are looked at as children who do not know anything, who do not have a sense of privacy, who do not have a sense of knowledge of who they are, So perhaps I thought that they're just coming and saying, okay, he's garbage, he doesn't know what is going on, doesn't understand his surrounding. So even if we go there, all of us, there will be no problem. Do you think that is also something that they are thinking?
Yes, I could 100% agree with you. Because even that has reminded me, even that particular moment, when I was being asked questions, they were laughing. Actually, I remember that they were actually laughing at that particular moment. So even as much as they are studying the psychiatry, even for them, their perception is that this person does not understand their surroundings. So anything that you do is funny because they assume that you don't know what is happening. Yes.
Which is which is disgusting, really. And the other thing is that, and we argued yesterday with you about this when for example, so let's talk about the slap and the wewe kudungwa shindano without you being explained to what is going on there. And I remember asking you this specific question that I do not think that this is how they go about learning how to treat people with mental illness in their schools. So why suddenly coming here into the real deal where these people who are mentally ill are, and they start treating them like this? Perhaps the question would be then, what is the curriculum? How do they study this? Because sometimes the people that I've talked with, when they end up in mental hospital, because this is not the first time that somebody's telling me that they were forcefully taken to a mental hospital. I spoke with a gentleman some 4 months ago, and he told me that he also went to the hospital, and everything that was done to him, he was never given a chance to speak.
Yes.
So do you have a feeling that something also needs to be done with the curriculum, or how are you understanding it?
I think for us in the movement in mental health, what we're actually doing, we're actually pushing for the deinstitutionalization of the mental health facilities.
Yeah.
Because it's one of the recommendations under the WHO that all these big facilities should be closed down because they form a breeding ground for human rights violations. And also, it's because also the mental health fraternity they're relying on what they call the biomedical model.
Yes.
The biomedical model means that mental health is a result of biological factors, and these persons need to be fixed biologically. And that's the reason why even one of the other human rights violations is over-medications of persons with mental condition. And that neglects the other factors that contribute to mental health, which are environmental factors, social factors, because all these biological, social factors, environmentals, all of them interact to contribute to mental health. So the current system neglects that all these other factors are not important, and they only focus on the biomedical model. So that's the reason why even now the medical fraternity just thinks of medications and medications. That's the only thing that they think of.
If I am sorry for cutting you short, if I am a child who is living, for example, in a foster home, or I am a woman who is being battered and mistreated by the husband, or vice versa, what I hear you say is that the medical fraternity, the health fraternity would not look at the problems that you're having at home.
Yes.
They wouldn't want to care that why is this person behaving this way? Can we fix what is happening at the foster home? Can we fix what is happening in the marriage? But then when you arrive at the medical facility, they want they want to give you medicine to treat it.
Yes.
And then you told me that it then should be, you told me that there's supposed to be three things happening at the same time: medication, therapy, and something else.
Yes, and there's also psychosocial support.
Yeah.
Because all these things interact together to contribute to mental health. Because my experience at that facility actually made me, even I can actually tell you I was more suicidal in the facility than I was at home. Because that neglected my a sense of feeling as if I was being treated as a lesser human being. When we found a private practicing psychiatrist, the first thing he said, this person should be released from the facility. And I remember telling you that even that release, they made my family sign a letter that I've been released against their wishes. And when I went to that psychiatrist, the welcoming place was very welcoming.
Yeah.
He welcomed me with a lot of smile. He stood up to greet me. He gave me time to explain, to understand my history, to understand my struggles, to understand my life where I want to be. And now he took time and told me that actually what you have is severe depression and anxiety disorder. And that's for the first time I got to understand what I was going through. He took time to explain to me what this condition is about. Again, he took time to explain to my family what actually this condition is all about. Then he told me these are the kind of treatment options that are available. And we developed a treatment plan together with him. It was not imposed on me. Yeah. And the treatment plan was for me to recover at home to a place where I'm feeling respected and valued. And within 6 months, I had reached a level where I've recovered. So the main thing here is about compassion. How you treat people is so very much important. And if you look at in terms of now, in terms of medication, that's when I came to learn that because of the underfunding in the mental health sector, even the type of medication that these facilities have are some of the wrong medication, because you have the first generation medications which have more side effects. That's the reason why you'll find other people are having muscles that are stiff. But if you take the second generation medication, which are a bit expensive, then you're able to live your life comfortably and recover without a lot of those side effects, and able to function within your daily lives. So you find because of that lack of funding, there's some medication that do not lack in government facilities. Yeah. And that is sedation medications. Because if you don't give a doctor the right tools to work, for them, they'll use what is available. Yeah. And their best option is sedating you. And there's something else I also noticed. If there's a sense of, I think it's a problem within the medical field or something in those facilities, by the virtue that you've gone into that facility, they actually assume that your mental condition is caused by drugs. Because for me, they actually pushed me that I have used drugs. That was the fundamental message that used to push to my family.
So they wanted you to tell them the drugs that you've been using?
Yes, and they almost believed it's drugs. So they actually forced me to do a test known as toxicology. Toxicology is a test that is done. If you've ever taken any drug and substance abuse, they'll detect it.
Yeah.
Except alcohol, because alcohol, unless it is in your system at that particular amount. When the results came, they found there's no drugs. None. And they were surprised. And they started saying, actually, kuna kwa na ile case moja.
That's interesting. Let's talk about the law and how the law, because we are talking about the idea that we are going to come back and discuss. I want to read an article in the New York Times, which has caused a lot of ripple effects in the United States currently, which is about Acadia Healthcare. So Acadia Healthcare has been under investigation for several years now, and the New York Times wrote a very detailed article about it, which said, perhaps I could read a little bit of it. Acadia Healthcare is one of America's largest chains of psychiatric hospitals. Since the pandemic exacerbated a national mental health crisis, the company's revenue has soared. Its stock price has more than doubled. But a New York Times investigation found that some of that success was built on a disturbing practice. Acadia has lured patients into its facilities and helped them against their will, even when detaining them was not medically necessary. In at least 12 of the 19 states where Acadia operates psychiatric hospitals, dozens of patients, employees, and police officers have alerted the authorities that the company was detaining people in ways that violated the law. According to the records reviewed by the Times, in some cases, judges have intervened to force Acadia to release patients. Some patients arrived at emergency rooms seeking routine mental health care, only to find themselves sent to Acadia facilities and locked in. A social worker, the article says, spent 6 days inside an Acadia hospital in Florida after she tried to get her bipolar medications adjusted. Meanwhile, a woman who works at a children's hospital was held for 7 days after she showed up at an Acadia facility in Indiana looking for therapy. So, you told me something about the law and how the law actually allows the people who are actually running these mental health facilities, to lock people in. Sometimes for people like Acadia, basically to earn profit. Yes. Because I was reading that for you to be at an Acadia facility, they charge you up to $3,000 a day. That's a whooping 330,000 Kenya shillings a day. And also you told me that it's very expensive to treat mental illness. So tell me about the law that allows, because you remember they could only let you go once your parents came, and the lawyer also showed up, and they had to sign the letter that you have been released against the wishes of the doctors, meaning that if the lawyer was not there and your parent was not there, then you would have remained locked in.
Yes.
Correct?
Yes.
So and then you told me about the law. How does the law protect the people in the mental health care community?
The law, even if there's been progress in terms of reviewing the Mental Health Act in Kenya, but still is still discriminatory, because we are under the current constitution, the new constitution, we are supposed to be free from torture, from cruel and inhumane treatment. Kenya is ratified what we call the Convention on Rights of Persons with Disability, which has covered persons with mental conditions within that legal framework. So it's upon the government to align its policies with the conventions of rights of persons with mental conditions. Yet even the current policy that actually passed, they still say that you can be involuntarily admitted in facilities. But it has to be, but also they say there is going to institute a board that is going to be looking at those involuntary admissions. But as you said, there's also aspect of money making.
Yeah.
Even if you look at the rehabs, that's the reason why you have also, that's the reason even some of the basis of the World Health Organization pushing for the closure of all these facilities to allow these services to go back to the normal system of community mental care is because, tell me, if you go to a rehab, they tell you that the minimum number of days to be in that facility is 90 days. Then I ask myself, which condition in this world that everybody has a recovery rate of the same period?
Interesting.
There's none.
And suspicious.
Yes. Some people recover with 2 weeks, other with 1 month, other 6 months. So why is it a standard of 90 days?
So it's a guaranteed earning of 3 months.
Yes. So it's also the money-making aspect of it. And also even in terms of the over-medications is also because of the pharmaceuticals where they are pushing certain medications. So that you find other doctors are prescribing a lot of medication. They don't want to look at the other aspects of care.
You talked about the task force, the Kenya Uhuru's task force in 2020.
Yes.
And then there was also the WHO task force that recommended a litany of changes of how mental health patients should be treated. Uhuru's task force, let's start with the WHO, and then you could also explain the Uhuru's task force and what it found out.
So the World Organization did a lot of survey in the globe, and they actually found out that persons with mental conditions are among the highly persons who experience a lot of human violations around the world. And the breeding ground for all these human violations, it's in the big institutions of mental health care. And also they found out that most of people, even the people being trained in mental health services, they have not been trained on the rights of persons with mental conditions. So because of that, they developed what they called the WHO call it rights. And that course is actually a free course that is done online. So it's a course that is supposed to be done by the whole community. If you're a caregiver or an advocate or a doctor or a person living in a mental condition, to actually understand how to promote and implement human right-based mental health interventions. And they actually even have a tool to help you implement the human rights aspect in your institution. So that's the reason why the background of that course was introduced by the World Health Organization. Yeah.
And this one of Uhuru Kenyatta, what necessitated it?
The funniest thing about sometimes I say some things happened. For us, what we loved, for us as in the mental health space, we loved COVID. As opposed to, I think other people hate COVID, but for us we loved it because what COVID did for us, it actually advocated for mental health what we would have done in 10 years. Because out of COVID we experienced a lot of mental health cases, and that necessitated for the government to institute a task force to look at the mental health status in the country. So COVID helped us to do a lot of advocacy for us. And that task force actually found out that there's a lot of human rights violations within the mental health facilities. They actually found out that the government only invests 0.1% of its health budget to mental health care, which is lower than what is recommended by the World Health Organization. So there's a lack of underfunding. They also found out as we told you about medications, there's less medications about the second generation medications in the market, but only the first generation medications. And one of the recommendations was that all mental health practitioners in the country to be trained on the human rights of persons with mental conditions, because they found out that they have a gap in that areas of training. And also, it also recommended that mental health issues to be declared a national disaster of epidemic proportion. But some of that task force has only been shelved. Some of the recommendations have not been done. And that's the reason they also found out that 25% of Kenyans have, at one particular point, have a mental issue. Yeah.
The first generation medication and the second generation medication, what is the difference? Do you know the difference between these two types of medications?
I think the psychiatrists are in a better place to explain it. But what I know is that the first generation medications have a lot of side effects.
Okay.
As opposed to the second generations. So if someone is being treated with using the second generation medications, they're able to live, yes, they are being treated, but also continue with their own life, continue doing what they love. But the second medication, because of the side effects, you'll find people are not very active. They have imekupin down kidogo.
Yeah. You talked about other things that we want to talk about the common types of mental illnesses. But I want to take you much back to the mental facility when you told me that sometimes you guys were being stripped naked, told to go and bathe. You were put in direct sunlight the whole day. Why were they doing that?
I think, as you said, there's this sort of misconception about mental health that by the virtue you've been told that you have a mental condition, you have no idea of what is happening within your surrounding. So I think there's that perception that if anything that we do to you, you not even know. So you'll find now you are being treated as a hard. As opposed to if you look at the other treatment plans of other conditions, people are treated as individuals. But here we are being treated as a hard. So if you're going to bathe, you're being told, come out, strip naked, all of you, taken to one place to shower, being whipped so that you take shower. Sometimes you're being told to wash each other. And that is in front of, let's say, around 20 or so students who are studying psychiatrist in that space. Then because the wards have human fleas, you're being told you don't go back to the ward, so you stay at the yard. Because you're staying at the yard, you're in direct sunlight from morning till evening.
Yeah.
Yes.
Okay. Unbelievable state of affairs. Something that I've always wondered, and you told me about it, I asked you about the people that walk the streets, like sometimes naked, sometimes with very dirty clothes, have not bathed for probably a year. You told me that they can be helped.
Yes, because mental condition has there are over 100 conditions, but there's what we call the common mental conditions. So one of the major common mental conditions, you have anxiety disorder, you have bipolar, you have depression, and you have schizophrenia. So schizophrenia is what people perceive it to be the worst mental conditions, because by being diagnosed with schizophrenia, you actually you detach from reality, and it distorts your perception of reality. And in all conditions in the world, they all have a spectrum.
Yeah.
So if you experience any condition and it's intervened early, then the high rate of recovery. If it's intervened late, the high rate of non-recovery is there. So, but by its own itself, that condition itself, schizophrenia, statistics say that it has a recovery rate of 65%. So what happens mostly is because people have said that he has been diagnosed with this condition, there's no hope of recovery. So even the attempt of people trying to help a person in this status, even the immediate care family, they don't do it because mental condition, people don't recover. That's the perception. So even the attempt is nowhere, so they end up not being treated. Yeah.
Okay. As we close the interview, I want us to talk about a little bit of the other mental illnesses, the anxiety disorder, depression, bipolar, ADHD, OCD. Let's talk with, you told me the most common one is anxiety disorder. Can you tell me a little bit more about it, how it manifests?
Anxiety disorder, we all have anxiety.
Yeah.
Yes.
That's why I'm wondering why it's a disorder.
Yes, we all have anxiety. But when it's classified as a disorder is when it starts interfering with your normal daily to life functions. So, by the virtue now you have anxiety, now for me, I'm diagnosed with anxiety disorder, which anxiety is disorders. But anxiety, we have different types of anxiety. So mine is generalized anxiety. So generalized anxiety means that I have no specific thing that is causing my anxiety. So anything is causing my anxiety. And you have like the social anxiety, where someone has social anxiety because of being in a social environment. So my anxiety manifests itself. I have high levels of heart palpitations, dizziness, sweating, excessive racing thoughts, and that's how my anxiety manifests itself. So, and it's affecting my day-to-day life. So that's the reason why now it becomes an anxiety disorder. Yes.
Okay. Then we have depression.
Depression should be distinguished from sadness, because people assume when you're sad, you have depression. But depression, for you to be diagnosed with depression, you have to be a period of sadness for more than a period of 2 weeks to be diagnosed with depression. And depression comes with, let's say, other symptoms such as suicide, because suicide has been actually linked with depression. We have whether excessive sleeping, excessive eating, yeah.
And then bipolar.
Bipolar, as the name suggests, is two bis. So two extremes. So you have extreme moods. So you have the depression side and you have the elevated side of the mood. So a person diagnosed with the bipolar shifts between these two moods.
Yeah. Okay. Whether sad or happy.
Extreme happiness.
Extreme happiness.
Elevated moods that are high. Yeah.
And then ADHD.
ADHD in full, it means attention deficit hyperreactive disorder. So what basically means you have this characterized by inattention. It's also characterized with hyperactivity and impulsivity. Yes.
Okay. And then OCD.
OCD is obsessive compulsive disorder. And I think that's the other myth that is in OCD. And people keep on saying that a person with OCD anapenda usafi.
Yes.
Which is actually false. OCD becomes, it's compulsive. You're obsessive, you have unwanted thoughts or images. And then you have compulsiveness about obsession about a particular thing, like a ritual to overdo it. So it depends on what is triggering you.
Yeah.
So if your trigger, let's say, is when you close the door, you keep on thinking you've not closed the door and you go back, and that is what is giving you anxiety. Yeah. Someone who is giving anxiety is because of that cleanliness, and so it's different, but people assume to be cleanliness, but it is not.
Yeah.
Yeah.
Let's wind down by talking about your organization, what you do, because perhaps people watching you would want to connect with you, would want to connect with the organization. So it would be nice if you can if you can tell us what your organization is called, some of the services you do, how you connect with the community of people with mental illness and their friends and family.
Yes.
Yeah.
So for us, we are called Psychosocial Development and Response Organization. So that is PIDRO Kenya. So for us, we are a survivor-led mental health organization. So what basically we do, we tap into the experience based of persons with mental conditions to actually develop the mental health interventions that they want to see in their community. So that's the reason why it's survivor-led. So what we basically do, we promote the rights of persons with mental conditions. So we believe in the power of storytelling. So we tap into the power of storytelling to drive change. So we train people on how to tell their stories to actually create change. Then we provide, where if someone is organizing a function and they want to have a speaker on mental health, we provide the speakers to them to come and talk about their different topics in mental health. Then we have also run a peer support group where we have people going through mental health conditions actually come and provide peer support to each other. Then we also do mental health trainings to both institutions, to corporates, and all those kind of services. And the other services major we do is if currently say you find someone who's going through a mental health distress, how do you help the person? So we do provide training where we certify you to provide the initial help to a person going through mental health distress. Yeah.
It was very nice talking to you, Mr. John Mwangi. I wish you well with the organization, man, and a great job that you're doing. Sometimes I think getting off the ground and trying to stabilize yourself and then taking even the other step of trying to help people is a lot of work to do. And for that, as people of this country and as people of the internet and people of the world, we thank you and wish you well with everyone. So thank you very much, people of the internet. If you have more questions about mental health, please, you can reach out to John Mwangi and his organization. And also, talk to, if you are a family also who is having somebody who is struggling with mental health, it is only fair that you seek help and the proper help for them and not locking them up to some dodgy mental health facility. Thank you very much. Until another episode. Bye for now.